Hello, everyone. Good to see you all. I can see Dr. Hassan. I know quite a few familiar names here. Hope you all are fine. I can see Dr. Haneen here. Hello, Dr. Haneen. Hello, Dr. Jessica. I can see Dr. Nandana as well. So good to see you. So because what we would do again, so we are here. Dr. Ahmed is here with me as well. I mean, he is online as well, and I'll soon pass it on to him. So this is again another beautiful journey of Dr. Ahmed. How from starting from preparing for ADC and with the success he's got. So he'll be sharing his journey with him with all of us today. It's good to have you. We just because yesterday there was a lot of incoming and outgoing. So we will be closing the meeting or locking the meeting in another 15 minutes. So if you either you have to personal message me or something like that if your internet connection goes off or something like that, or if you are out of the meeting, for me to let you in. Just try to be as stable as possible. It would be good to see your faces as many as we can, just so that it gives us a context as well. And also because it doesn't feel like you are talking to the computer. It just feels like you have people in front of you. So, and also as I mentioned yesterday as well, it's a good OSCE preparation session as well. Yeah, no, I'm just kidding. So just if you can just turn on your cameras. Feel free to write any questions that you may have. Dr. Ahmed's journey, yes, he is, and he, along with his friend Dr. Mahmood, they are quite special to us as well. Um, they are really good. They are helping a lot of, and they have been until now also helping a lot of candidates in their part 1 exam, and with a very successful and good results. So we are really proud of them as well to do what they are doing currently. And also I will just pass it on to Dr. Ahmed. I think we have quite a few people here with us right now. So over to you, Dr. Ahmed. If you have any questions, please feel free to write in the comment box. So he'll be sharing his journey, and we have at the end of the presentation a lot of FAQs that people have been asking, and all the questions that everyone has. So we have put them all together. So just wait till the end. If just in case you feel that your question is not being answered, please write it in the comment box, and we will surely be answering that as well for you. Over to you, Dr. Ahmed.
Thank you, Kanika, very much for this nice presentation. Thank you guys for attending this session. Yes, I did it finally. I passed the ADC part 1, part 2, of course. It wasn't that easy journey, like what I can say, we can call it like abstaining easy, because you face many obstacles. You have to spend a lot of time studying. You have to cut um, periods from what you have to give to your family, because all of us, of course, have families and we have responsibilities. But the problem, ADC uh, affects, yes, our responsibilities, and like it makes a lot of loads on our partners and our homes. Anyway, by the end, when you pass, you will feel like all that already was like not useless. Was like I don't know actually what to say about that, but let me start with you about how I go through this journey. Of course, I will not talk about the written exam. Of course, after written exam, because all of us passed already the written exam. So First, I passed my written exam on March 2018. It was my first attempt. Um, Maybe because I didn't, to be honest with you, I didn't take any course for part one, but because I'm an endodontist, so I'm always reading, I'm always searching for articles and for everything that can help me in managing cases in my clinic. So yes, maybe that helped me a lot with part one, and of course a little bit with part two, not much because I am an Arab. I am working in Saudi Arabia. I am from Egypt. So our concepts in managing patients is of course a little bit different from Australia. But you know, when you try to collect the puzzle pieces together, you will have a good image at the end. Anyway, so after I passed my written exam, I didn't know anything about part two. In my life, normally, when I have or when I am going through a journey, I just take it step by step. So I don't try to know anything about part two till I finish part one. When many of my friends told me, okay, you have to prepare for the English test during the part two, I told them, no, I will first finish part two, then I will try to search about the English test. I try, or I like to take it like step by step. So after I finished my part one, I started to collect some like info from here and there about part two. And to be honest, I got shocked about what we have to do, about the exam, about the materials, about the expenses. Oh my God, I have to spend a lot of money. And even I didn't know from where to start. So, as all of us do, I started to search for a friend who already within the process, who already started to collect materials, to buy teeth, and to search for courses, of course. So I talked to one of my friends. She already started. She passed in September 17. So I thought she know better. I asked her what about teeth we should buy. She bought me a lot of teeth. I don't know about anything. Even when I was like checking what teeth she bought for me now, I found like I spent almost about $1,000 for nothing. I bought curious teeth for, and she bought me anterior curious teeth. She bought me lower endo molar teeth. Anyway, so after that, I think I started to think like I have to search by myself because okay, I have the teeth. Then what? I started to see videos on the YouTube for, of course, good coaches. To be honest with you, like all of us watch their videos like Dr. Muhammad Salman, but still, I didn't get like what I need. I don't have the exact criteria. I tried to search in the ADC written examination book, but still, it's like it's not clear what they want, how I would or how I will achieve this criteria. So I decided to take a technical course. Um, and I had to travel. So this is one of the obstacles I have to do. I have my work. I have to take vacation for a long vacation from my work, like 1 month. And this it will not be like a family vacation. No, it will be a study vacation. So it will affect, of course, my family. But there is nothing I can do. So I took my technical course. Maybe by January. Yes, January 2019. Um, In the technical course, I learned everything about technical criterias. And to be honest, once I finished the course, I felt like I have all the information I need about technical. So I returned back. I returned back home. I started to practice. I collect all the materials I need, mannequin, teeth, um, materials. I started to practice daily. After that, I had to do something about the OSCE. Okay, technically, and the technical tasks, I'm good, and I know I can do it. Especially, I am practicing dentistry every day, so maybe my hand skills like are good. And with the course, of course, it's improved, and I know now the criteria, so I can, yes, do whatever ADC will want us to achieve in the technical exam. But the problem here, the OSCE. I know nothing about the OSCE. So yes, my first attempt, because Kanika said, as Kanika said, I help people in part one, so I have a lot of information about written exam and about the books, because like I said, also I read a lot of textbooks and articles. So I thought I will depend on that with my first attempt. Still, the technical OSCE, the clinical evaluation and the technical OSCE, I don't know about it. Okay, there's anesthesia, extraction, X-ray. Here, one of my friends suggested me with Dental101 that they have a very good preparation for OSCE. So yes, okay, then I have to yes, to book with them. So I went there before my exam. My first attempt was in June 2019. Late June, maybe it was, I think, 25th and 26th of June 2019. So, or 26 and 27, I really don't remember the exact date, but it was either 25 or till 27. Anyway, so I went there 1 week before the exam. I took most of the technical OSCEs, like anesthesia, extraction, X-ray, infection control, scaling, and I really was, you know, I don't know what to say about that, because but they taught me every single trick with the technical OSCE, and Dr. Depeche actually told me exactly what I will find inside each station. But after I took these technical OSCEs with them, I said, okay, I still have about 4 days, so why not to do a supervised session for technical training with them, so I can see how they can evaluate my work, and it's actually good to practice before the exam. So yes, I booked with them also about 4 days, I think. Yes, 4 days for technical, for supervised technical sessions. It's simple. You go in the morning, you start practicing all the tasks, then you ask one of the supervisors there to evaluate your work. And this actually was like what we can say. So it was very, very, very good point for me. Why? Before these days, I know how to achieve the criteria. I know all the criteria. I know how to do the finish line. I know the thickness of the finish line. I know how to do endo access. Of course, I know all the technical criteria, but I didn't know how to evaluate my work, how to understand if my task is well prepared, or I have any like defects, or any points where I didn't fulfill the criteria. And actually, they taught me how to do that very good, very, very good. And that was before my first attempt. So I took my first attempt. I like I told you, technically I didn't think it was a problem, and I followed their what they they told me exactly in the exam, in the technical, and in the OSCE. I entered the stations. I found the same as Dr. Debesh mentioned about the skilled OSCE. Exactly, he told us like you will find two types of guides in the X-rays, and it will look like that, like that. And he showed us them. And when I entered the station, I found exactly what he said. Even in the local anesthesia, in the extraction, in the X-ray, it was really exactly as they say. And So I thought I will pass because I have all what I need for technical and skilled OSCE, and for OSCE communication, I read all books, I read all notes. This book for cases, which is I think it's called fourth edition. I have it. I memorize all the cases. I memorize the cases for the file of I think the file drunken nurse. This file I memorize everything. I read all the DHSV, the Dental Health Service of Victoria articles, and I memorize all of them. So I thought, yes, I will pass from the first attempt. Then the results came. Uh, the result actually was a little bit shock for me because I passed all technicals. Like I told you, I have no problem totally with technical. I passed all skilled OSCE thanks to Dr. Debesh. He taught me everything about that. But I failed in stations 3 and 4, which failed me the diagnosis and management cluster. And that actually was, I don't know what to say, because you will find yourself past everything. But the problem, you failed the exam for one cluster and 2 stations, which are diagnosis and management. So it was actually a shock for me. Even by that time, I thought I will not do it again because I did my best. I thought I said everything in the OSCE. I did study everything. So what else I can do? Even my friends, I have some friends who teach part 2, but they are friends, so it's not like we are not dealing together with a concept of a tutor and students. No, we are friends. So when they saw my results, they told me they don't know what to say, but they told me you must do it again. So I start to like rearrange myself, uh, gather everything. I start to attend sessions again for OSCE. Of course, all of us are part of groups, WhatsApp groups for OSCEs. I start to attend and attend the set which I had in my exam, the OSCE communication set, and I found it's still the same. I said there is nothing wrong. I mentioned all the points. So what's wrong? Then I decided, okay, I will give a second shot. So I will. I found Dental101 in the skilled OSCE in the first attempt. They were really good in the technical evaluation. They were perfect. They even taught me things before the exam, 2 days before the exam, I didn't know about. So okay, and they have a good stuff. Especially most of their stuff just passed recently, so they know what they want in the exam. So I decided to join them for their full week OSCE course, and of course I also booked another 4 days for supervised technical sessions. When I went to this time to this week of OSCE, I found myself like, yes, I know everything. I know all the information they want they want to hear from us. But the problem is the structure, is the strategy, how to approach the patient in the exam, how to deliver all the information you read to them, how to really show them that you are an experienced dentist, that you are not just someone like all others. And that actually, they taught me how to do that. They gave me structure. Actually, I don't want to forget anyone, but Dr. Lina, Dr. Gada, Dr. Edith, uh, all of them really, they helped me a lot with in the OSCE, and they told me exactly how to approach each case. They had a lot of trust in me. Even all of them told me you will pass, but still I wasn't like confident enough because I know what happened in my first attempt. But I decided I will do exactly what they told me, and I appeared for the second attempt. Uh, and in the second attempt, I really uh, 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 like did exactly what they told me in skilled OSCE and in communications. And in the technical day, even when I followed what they taught me or how to evaluate my technical work, I knew before I leave the technical day that I will fail in the crown preparation, because I have 2 points, 2 mistakes I did, but I couldn't correct them, because if I will correct, I will make it worse. So before I leave the exam, I knew I will fail in the crown preparation, but I tried to make everything else perfect. So even if I will fail in the crown preparation, the all other cutting tasks will like help me to pass the cluster of cutting. Uh, After I finished the OSCE day, I wasn't sure enough I will pass. I think I did everything. I think I talked about everything. What were those mistakes? Okay, I had it was the canine preparation. I had these 2 points, which were equigingival, just 2 points, one in the medial and one in the distal. You know, when this part from the labial, when you start to go proximally, these just 2 points, the tooth or the gum in this point start to like be higher than the labial level. So this is a very tricky point, and I fall this time in this mistake. While when I was practicing, either before I go to Australia or before even the exam in Dental 101, I was very careful with this point because I know about this trick. But in the exam, I fall in this trick, and I knew I will fail in the crown cutting because of these points. I know in the criteria, in the handbook, it's mentioned that if you will do equigingival, it will be not very good, but it will be satisfactory. But still, I knew it's 2 points, and I knew it will fail me. And yes, when the results came out, it was a fail in crown preparation, as I expected. Yes, it's satisfactory. Of course, equigingival is satisfactory, but I expected that, and it was a fail, like I told you in the crown preparation. But all other tasks were passed, and I passed the exam. Um, okay. When I got the result, I don't know what I say. I got shocked. I was going to have a heart attack because I didn't believe myself. I didn't believe I would do it. I thought it's just, it's just a dream, because all of us hear stories about people who pass and about people who fail. All of us hear about people who are really perfect, either in technical or in OSCE, but they fail in the exam. And in the same time, we hear about some people who we know maybe they are not that good, but they pass. So yes, it's very difficult how we can achieve or how we can do what ADC wants. We don't, all of us don't know what they want, what they need in the exam, and that actually is a problem. So see, what I found from my attempts, my 2 attempts, ADC, they like, they don't want someone who is from the space. They don't want an alien. No, they just want a certain criteria. If you will follow these certain criteria, you will pass. They don't want you, when you enter in the communication, to talk about everything in details. No, just talk about what they want. And actually, Dental101 helped me with that very much, especially in the mock exam. I will tell you, you know, my mock exam, I had my mock exam 2 days before my actual exam, and the technical tasks they gave to me in the mock exam, it was exactly the same as my technical exam. So I you know, I don't know, like, okay, how did he knew about that? But it was yes, they it was exactly as the same tasks I got in the mock exam um, came in my technical exam. So also in their mock exam, you know, they help you to try to manage the OSCE communication. They help you to practice within time. Even all of us, I know, are practicing OSCE with our friends, and we put the timer and do everything as in the exam. But practicing the mock tests is something else. It's really different, and it's really important before the exam. So yes, ADC, like I said, they don't want someone from the outer space. Just know what they want, what criteria they want you to achieve. uh, in the communication. Like I said, what I felt this time, they just need headlines. When I was giving details about, like, for example, let's say I will talk now about dental hygiene. So I will inform, I told the patient, so we need to improve your dental hygiene. Okay, then I notice the examiner making a tick on the iPad. Then when I start to talk about the details of the dental hygiene, I saw that the examiner is not taking anything on the tablet, and in the same time, the patient is just moving his head like, okay, okay, move on, move to the next point. So they just they don't want much details. They want to know if you know everything about the case and in like headlines or not. So I think now we can move to the frequently asked questions, but there is one question in the um, there is one question in the chat. In info gathering stations, if the question sums up most of the signs and symptoms, leaving us with only few questions to ask, how do we tackle it? Do we ask again what is directly given? Okay, see, in all OSCE stations, there are a structure you should follow. And here, I would like to thank my friend uh, Hanin. I think she is attending the session. She gave me this abbreviations for collecting the structure in just one word, which is MESFEDO, MSFDDO. This like give you the structure of everything, like M for medical history, S for social, F for family, D diet, D dental history, and O oral hygiene. Actually, she helped me very much with that. Even Dr. Hanin, when I entered each station, the first thing I do, I write these letters on the paper they gave to me. Okay, so regarding your question, Doctor, about the info gathering, first of all, you should fulfill the missing, write on the scratch paper they give to you what is written on the screen. Like, for example, the patient complaining of what we can say, an ulcer in his mouth, and this ulcer appeared 3 times before. It's painful. All of that you put. Okay, I will write it. It's C for chief complaint, M medical, S for social, F family, D diet, D dental, history, O oral hygiene. This is it. Uh, you should write down all the information which is given on the screen. Then you find the blanks. There will be, of course, a missing points. These missing points you must ask. This first. Second, you should like confirm the given history. Like for example, the case for the patient who having the myocardial infarction and osteoporosis and is taking Prolia and blah blah blah. So you should confirm this point. So it's mentioned here that you had a myocardial infarction attack when this happened. It happened like three years back. Okay, it's mentioned here that you are taking a medication called Prolia for osteoporosis. Is that correct? So you should confirm all of that and add uh, and add the missing points in the form of questions. This is how you will fulfill all what they want in the information gathering. The other D, it was the diet. So in all the cases, you put these letters in front of you. You start to answer all the questions. You start to find the missing points, the missing info, and start to ask about it. And of course, if there are irrelevant questions, like for example, the patient who where you are going to extract a tooth, there is no use to ask about diet. So just remove this question from your structure, and so on. So now I will start with the frequently asked questions. Then if any of you have a question, we can answer it. So is this exam doable? Is it easy or difficult or what? Like I said, the exam is what we can tell it's abstaining easy. You don't need to be a Superman to pass this exam. It's just you have to understand what ADC want and how to achieve that, how you deliver them the point in the way they want. It's like talking to the patient in your clinic. Like when you, for example, if you have this in the case for the Jordan, the 17 years old who having the CPITN and so on. So he is 17 and he is present in the clinic with his mother. So don't ask him. He is below 18 years. You should ask about smoking, but don't ask him like you are asking any simple question. Are you a smoker? Or do you smoke? No, it should be, you should be smart when you do that. Like, for example, you can say, between you and me, do you smoke? It's like, a simple thing that you can do which can help to show the examiner that you know how to deal with this age while the mother is there. Okay? So it's not easy, it's not difficult, and it's achievable. Another question, according to you, what is the right strategy to prepare for the exam? The correct strategy to prepare for the exam is practicing. First, get all the criteria you need, okay? Then start to apply these criteria while you are practicing. Start to evaluate your work by sending to your friends. You don't have to have your friends can be just candidates like you, and they can evaluate you. One of my friends, her name is Dr. Ragda, and she already attended also the course with Dental101. She helped me every day with evaluation. I sent her my technical work every day, and she evaluated for me. So it's very important to practice daily. OSCE, you have to practice OSCE daily with your friends. You know the cases, you have this book with cases. You should practice these cases. Try to do all the cases from different with different clusters. Like for example, the care risk assessment, do it as information gathering, do it as diagnosis and management, and do it as treatment planning. The exam, even if you will appear in the exam and you will find new cases, so still you are a dentist, you have the structure, you know everything about dentistry, so you can apply this with the structure in the exam, which will help you to pass this exam. Okay. What kind of guidance do you suggest to take? Taking demos from individuals who pass the exam or an institution? What do you suggest and why? Okay. Like I said in the beginning, I watched videos on the YouTube, but still I am missing important thing, which is how to achieve the criteria, how to overcome the obstacles I will face. Like for example, when we are doing the crown preparation, how I can prevent damage to the adjacent teeth. All these are tricks how to get the perfect contact. You will not be taught how to do that in the videos. You must see this live, like on a course. I believe that, see, part one, I give part one help courses, but I still believe that you can do part one by yourself, but part two, I don't think so. I I don't know. No, yes, I know just two doctors who passed ADC part two exam without courses, but one of them is working in university in Egypt. The other one, her husband, is a dentist in Australia, so he know about the criterias and he helped her with that. But to achieve that with yourself, I think it's difficult. How many time it take to get through OSCE as finishing in 10 minutes is a trick, even if you understand. It will take you about 3 weeks, I think. If you are practicing every day with friends, after 3 weeks, I think you will be able to manage the time problem by see, what make us lose time is going very deep into details, and this is a problem. This is really problem. See, like I said, ADC want headlines. Just you can mention the point or the headline, then you can add few points about this headline, but you don't have to go very deep in the details. So because that makes you lose time in the 10 minutes. Another thing is repeating questions or running around the same points with many questions like, do you have stress in your life? The patient will tell you, yes, I have. So, are you aware of grinding your teeth? Do you think you have pain in your muscles? So, the patient give already the answer for you, like he has a stress in his life. This will help you to simplify the point for you that this patient having stress. So, yes, he is doing bruxism. You can ask just one more single question. You don't have to ask 4 or 5 other questions to confirm this point. This is how this is how you will be able to manage the 10 minutes. um, okay. um, is there any missed questions? No. Okay, very good. Okay, so you're most welcome, doctor. Is it sufficient if I watch YouTube videos? I answer that YouTube videos are very good, really helpful, but still, you will be missing the tricks and no. I think you have to attend a course whenever or wherever you will go for a course, but you will have to attend a technical course. it will help you. It will help you really much with the technical criterias and how to achieve all these criterias in all situations. Okay, the next question is, if I am a beginner, how much time would you recommend I would need to be completely ready for the practical exam? It will depend. See, to be honest with you, some dentists graduated 5 or more than 5 years back, and they never hold a handpiece since they graduated. So, of course, the time they will need to adapt their tactile sense and their hand motion with tasks will not be the same as someone who is practicing dentistry every day in his clinic. So it will be different. So I think if you are practicing dentistry every day, after the course, after you get the technical course, you can prepare yourself maybe in 4 to 6 months after taking the course. And of course, you are practicing dentistry. If you are not practicing dentistry, so you first have to give time to adapt your tactile sense, which is very important. You have to feel everything with your fingers. This is very important. When you adjust your tactile sense, then you can count about 4 to 6 months practicing before the exam. How many hours per day or per week should I be spending on practicing? Again, this question is difficult to answer because again, like first, how is your tactile sense? Second, how many hours you are able to practice every day? How you can give time to practicing. All of us having responsibilities. I have a family, I have kids, I have my wife, and I have my work, my clinic. So you have to arrange your time and find how many hours daily you can practice. Of course, don't try to waste a single minute. If you will have a free time, practice in this free time. So if you have a home setup and you can give about 3 to 4 hours daily, that will be very good for practicing before the exam. Try to take at least one day off, so you'll not get bored, because you will be practicing for 4 to 6 months. If you are practicing daily and you will not take any off, it will be difficult. So try to take at least a weekly day off. That will help much. How many days? Of course, you must practice all the days, like 6 days a week. 6 days a week is very important to practice, because every time when you practice, you will find or you will learn something new. Like, for example, now I did more exer reduction on the buccal surface. So next time I should not use this burr. I have to use another burr. I have to apply little force and so on. There is a question on the chat. Please, could you tell us how you observed infection control during the OSCE task? Okay, I took first, before the exam, the infection control session with Dental101. Then I did exactly as all of us know. One more thing, I am working in a hospital where we have the GCI certificate. I don't know if you know what is GCI. It's one of the highest certificates in quality. So in my clinic, we follow almost the same infection control protocol we follow with the ADC, like the hand hygiene, like the PPE, everything we are following the same. So let's say I will enter the station. Let's say it's a local anesthesia station. I enter the station. I first have my goggles. So I put my goggles on the clean area. I just pull a tissue and put it over the clean area on the second shelf and put my goggles. Then I start to read the scenario. I I will have a look around me of the bracket table, what present on the bracket table, what present on the clean area. If there is a TG or MEMS, pretend you are using them. Even it's mentioned, for example, like the patient is taking in depth. You know that in depth is SSRI, so you can give adrenaline with no problem, but still pretend like you are searching for it in the MEMS and in the therapeutic guidelines. This is, I think, this is important step. I did it in my 2 attempts. I had local anesthesia. I did it twice, and every time I passed the anesthesia. After that, the timer starts, so I start my hand hygiene. I counted my hand hygiene from the hand wash till I will till then after that I wear the mask, then do hand rub, then wear the goggles, then go to the bracket, the clean area, collect my stuff, put it on the bracket table, then I do again hand rub and I wear my gloves. This almost take about 1 minute and 50 seconds, almost the hand hygiene and collecting your stuff, and it will take about 1 minute and 50 seconds. Then I start my work. Try to manage your time to leave at the end at least 1 minute and a half to do again the hand hygiene. So I finish the task, then I do the sharp management, because sharp management, of course, is very important in the anesthesia task. Then after that, I remove my gloves. I do the hand rub. I remove my goggle. I put it again on a tissue in the clean area. Then I do the hand rub. I remove the mask, throw it, and do hand hygiene. Then I leave the station. This is how I manage the infection control in the OSCE tasks. In skilled, there is another question. In skilled OSCE station, do we have to tell the examiner what you are going? No, I never did that in my 2 attempts, and in my 2 attempts, I passed all skilled OSCE. Even in the extraction task, I didn't give any instructions. I didn't tell about anything. Okay. Okay. So last question in the FAQ, especially during downtime. There's another question. Do you think we should continue to work during our exam preparation? If yes, how many days? See, like I said, all of us have families and have responsibilities. Yes, maybe your partner is working, but still, nowadays, of course, all of us are working because we need money. We need money and we have responsibilities. So for me, I was working 5 days a week. I'm working full time. So I was practicing in my clinic in the break time, and also whenever I have time, after I go back home, I practice. This is very important. So yes, you should work because we have responsibilities, but the most important is how to manage your time. If you'll be able to manage your time between work, family, and of course your partner must help you. I really, I whatever I will do for my wife, because she stood beside me in every single step. She helped me. She like was taking care of my kids. So yes, your partner must help you, and then yes, you can work full time for the whole week. Last question on the FAQ, especially during this downtime where we are, sorry, this part of the screen, we are completely demotivated and unclear. How should we prepare for the exam? What should be our strategy during this time? See, like I said in the beginning, and like Kanika said, I give help for part one. So I have my students who, of course, are all of them affected with this circumstances and the curfew and the quarantine and everything. So if you will stop, okay, you will not be able to restart again. Okay, I believe at least you practice daily for 1 hour this period till we know about what is going to happen or when the exam will restart again. So don't stop practicing. At least daily start for 1 hour. At least try to make one task daily. OSCE, make at least one case daily. Don't stop practicing. Whenever you will stop, you will not be able to restart. You will not be able to collect everything again or return back to the same state. Or whenever we are, even me, when I started to talk in this session, in the beginning, I am not able to talk fluently. I am not able to go with whatever I want to say. But by time, I get used to the situation and I adapt myself and I can do what I want. So the same for technical practicing and OSCE practicing. If you will stop, when you are going to start, it will be really difficult for you. So you should not stop practicing daily, at least for 1 hour or at least for one task daily. This is very important. Okay, I have questions on the private. Where to put the Googles in the OSCE station and how? Okay, I did like have two attempts, like I said. In my first attempt, what I did, I picked a tissue paper and put it behind the sink and put my Googles before and after I finished the task. This is in my first attempt. And I passed the tasks and infection control also. In the second attempt, I did something else. I tried to put the tissue with the Googles on the second shelf in the clean area. And I also passed infection control and I passed all the tasks. So you can put either behind the sink or on the second shelf of the clean area. Even when you will enter the station for skilled OSCE, you will find on the second shelf of the clean area, there are some Googles they put in case you don't have a Google. So there are some Googles present in this area. So I think, yes, it's correctly should be placed on the second shelf on the over the clean area. It's like a trolley, so it has two shelves. You can put on the down shelves. For example, local anesthesia. Yes, okay. Thank you, doctor. I have almost stopped to practicing. No. You must not stop practicing. Like I said, at least do one task per day. Let's say we have 6 tasks. So one day you do the crown preparation and the temporary crown. Of course, you must do both together. Second day you can do amalgam. Third day of the week you can do composite. The fifth day you can do endo, and then the last day you can do curse task. Then you have 2 days off. So you can put 1 day off in between, like 2 days, then 1 day off, then 3 days, or the end of the week, put the 2 days together as you like. But the most important is not to stop practicing, either technical or OSCE. This is really, it's very important to keep practicing. So, any other questions? You're most welcome, Doctor.
Thank you so much, Dr. Ahmed, for lovely, inspiring presentation and sharing your journey. I think we do have 2 more questions that I can see here, one from Dr. Himanshu and one from Dr. Pratibha.
Okay, I didn't receive them. Where? Maybe they sent for you on private.
Yes. It's, I think, in private. So what I'll do is I'll copy paste on the forum for you.
Okay.
So that everyone can see. So this is from Dr. Himanshu, the one that I've just sent, and there's one from Dr. Pratibha that I will send.
Okay. First question, as part 1 candidates, what we can read during this time, which will help in part 2 prep as well. See, like I said in the beginning of this session, I don't like to put many things inside your mind. I like to do or I like to take each step first. After we finish this step, we can search or start to prepare for the second step. I believe that you just read what is related to part one. Okay, part one, we have a lot of books that we have to read. After that, when we will start to prepare for part two, we will find like many of the tips that we have read during part one is important for part two. Don't try to what I can say, to put a lot of load over your brain. This is very important. This will affect your part one. So no, I prefer you first pass part one, then you can start to prepare for part two. A common material applicable to both part prep. Same like my answer. Like I see it's better to prepare for each part alone. Is it necessary to use magnifying aids? See, uh, for me, I am working as an endodontist, like I told you. So I'm using magnification in all of my work. So for ADC, of course, I will not be able to use a microscope in the exam. So I have to, yes, I used a magnification, just normal loops. It was 3.5x, so it's not high magnification, but it helped. But still, I know some guys who didn't use magnification and they passed. But the good thing about the magnification, it will help you to see simple points. If you have, for example, a simple scratch that you will not be able to see with your naked eye, the magnification will help you to see it. So yes, I think it's better. It's better, but it's not necessary to practice with magnification. But if you will not practice before the exam with magnification, never do the exam with never appear in the exam with magnification. If you use magnification in the exam, so practice with the magnification. If not, then okay, no problem. Uh, um, in the exam, I think, no, is it clear when the case is information gathering, diagnose management, or clinical? See, it will depend mainly on the question asked. So sometimes they will ask you gather information. Sometimes they will ask you manage the patient condition. Sometimes they can tell you discuss with the patient your finding and give differential diagnosis. So it's like try to follow the structure with all the cases, okay? And answer, the most important is to answer the question in the bold letter. This is very important. If you will follow the structure and answer correctly and completely the question in the bold letter, you will pass the station. Because there is a very important point. Some guys are just reading the first part of the question, but they forget to read the other part. Because sometimes, for example, in my exam, I have one station asking in bold letters, discuss with the patient your findings, give the patient differential diagnosis, give differential diagnosis if required, and manage the patient condition. So it's three questions. So you must answer the three questions. Okay, so the most important, follow the structure, answer the questions, then you will pass the station. Either it is information gathering, either it is diagnosis and management or treatment plan. For example, they can tell you perform case risk assessment. So how you will perform a case risk assessment? Of course, you have to do information gathering. You have to find the cause of this level of cares, and you have to inform the patient which category of cares risk is a child. Like, is it moderate or high or low? And you have to answer this question, you must ask all the question related to the case. So it's information gathering. So it will depend mainly on the question and on the presentation of the case. Does the patient ask a lot of questions? It will depend. If you can control the station, if you will be able to control the station and give the patient all the information required, he will not ask you any question. He will not be able to ask because you fulfilled already all the questions. At the end, he can ask you just a simple question. Maybe a question you didn't answer, or maybe something he want to confirm that you know, or maybe a point that wasn't clear during your presentation. But if you are not controlling the station, then you have to know that the examiner will not stop asking you questions. So it will depend on how to approach the case. Will you be the controller, or the patient, or the examiner will be? So any other questions?
Start. So all good, Dr. Ahmed. I think we've answered quite a few questions. So I
Hello,
have
Dr.
Dr.
Devesh.
Devesh with me here.
Hello,
Hello,
Dr.
Dr.
Devesh. How are
Ahmed.
you?
How are you?
I'm
Good,
fine,
good.
Dr.
And
Devesh. How are you?
congratulations
Thank,
once again.
thank you very
You've
much, and
done
thank you for
very
all the
well.
help you. Yes, thank you very much for everything you did with me.
We are here to help, and you've done a very good job, and you deserve all the credit. So, congratulations.
Thanks, Dr.
Um,
Devesh. Thank you very much.
just in conclusion, I think it was a very informative session, and everything was very good. Just as a parting note, I think all of us are trying to juggle a lot of things, so I will keep it very, very short. These are very difficult times, and everyone is doing what they can with whatever information we all have. Don't lose motivation, don't lose focus. No studies go to waste. Whatever you are studying at a smaller level or at a bigger level, every day, every 2 hours, or every second day, everything will help. If not for ADC, for your own private practice. If not for anything else, for something else. But don't lose the motivation. And second thing that and two more things that I want to say is that this exam is a face-to-face exam. Nothing will replace that. You do what you can, online, offline, whatever you can, but make sure that you also have some sort of face-to-face interaction whenever it is safe to do so. And last but not the least, you are all dentists, you are all doctors, you are all practicing or have practiced previously. If you behave like a dentist or a professional, they will treat you like a dentist and a professional. If you behave like a student, they will mark you and treat you like a student. So keep your confidence up, smile, and just do the basics right, and everything will fall in place. Do you agree with that, Dr. Ahmed?
Yes, of course. Like I said, you must show them that you are the controller. In your clinic, the patient will not control what happened inside the clinic. You are the one who control. If the patient, whenever the patient will control you inside the clinic, so he will not trust you. So that's why in the exam, you must show them that you are the controller, you are a dentist, and you know how to manage each situation.
Exactly, exactly. And hopefully all of this settles down soon and we get to see a lot of you. And Dr. Ahmed also, we're waiting to cut the cake with you in Melbourne here. So we'll see
Inshallah.
you soon. Inshallah.
Inshallah. Thank you,
And
Dr.
thank you.
Devesh. Thank you, Kanika, very much.
No
Yes.
worries. Thank you so much
Thank
for
you. Thank
your
you.
time. And thanks to everyone who has attended this lecture. Hopefully it was helpful. As we always say, anything you need, or even, I mean, it's not only about dentistry, as we always say, even if you feel low, you want to talk, just give us a call. I mean, it's good to have someone to keep you motivated. And, you know, during this journey, we all know how difficult this is. So we wish you good luck. Keep practicing. Do not get demotivated. Do not give up. It's just a little bit of slow time, but things will be fine soon. So good luck. And if you have any other questions, feel free to leave it on the post. And I think we both will be happy to answer that for you as well. Thank you. Have a good night.
Thank you so much, Dr. Ahmed. Thank you.
Thank you.
See
Thank you
you.
all for attending the session. Bye. See you.
Thank you. Thank
Take
you.
care.
Bye-bye.
Bye-bye.